Takeisha. So, Takeisha, please tell us, who is Takeisha so we can know who you are.
Okay. Well, first of all, thank you for having me. My name is Takeisha Nunez. I work with UK's Target 4 program. And what Target 4 is a program that specializes in harm reduction, and those pieces of harm reduction that we specialize in are HIV and Hep C testing, as well as linkage to care for HIV and just prevention, the prevention piece. I lead a team of 6 individuals. We work in Jefferson County as well as Bullitt, Odom, Henry, Spencer, Trimble, and Shelby County. And so we go out into the community. We do condom distribution so that people can prevent getting HIV and other STDs, as well as doing HIV testing and linkage to care. So if someone tests positive for HIV, we help them to get into care, to get the medications that they need. Or if someone is at risk for HIV and they test negative, we link them to care for PrEP, which is a medication that helps to prevent HIV. So another tool. So first of all, I want to say you're right. HIV is taboo, whether it's in your culture or just in America. It is the one thing that we all have come from and all will do, but we're all a little bit afraid to talk about it or uncomfortable. And we have to get comfortable with the conversation and understand that HIV is now not a death sentence, because it used to be scary. Like in the 80s here, people would die from HIV. Now there's medication that if you are tested, that you can live longer a lot of times than someone who's HIV negative, because you're going to the doctor and you're taking care of yourself a lot better than like we normally would. Cause I'll speak for myself. A lot of times I can make excuses for not going to the doctor. Whereas someone who's HIV positive, they know they have to go, they're checking on themselves. And also once they're on the medication, they're not spreading it to anyone else. And so, yeah, so it's a lot of, if you know you have it, you can stop the spread by taking your medication, and because it's U equals U, which is undetectable equals untransmittable. So the medication makes them undetectable, and so they can live a normal life. But the most important piece is knowing, because you can't do it without knowing. Prevention is a lot of different things. I tell people that this is your body and you have to protect yourself. And having those conversations, testing together with a partner can be a part of prevention. Someone can get tested and they had their tests 3-4 months ago, but how many partners have they had since that test? So that's not accurate. Prevention is using contraceptives, different types of condoms, and we have several different types that we'll talk about at another time, but it's all about how you present it. So if you act like you don't want to use it, then your partner's not going to want to. But this is about protecting your temple, your body, and keeping yourself safe. And also there's PrEP, which is a drug that helps to prevent HIV. So if you are not in a relationship where it's only one partner, or you're concerned about what your partner may be doing, then PrEP, you would take it every day. I look at it almost like birth control for HIV. So you take a pill, it prevents you from getting HIV, or you can get a shot every 2 months that will put it in your system and prevent you from contracting it. I think one of the biggest misconceptions is that HIV is just for gay men. Women get HIV, straight men get HIV, black women have the highest numbers of HIV compared to any of our other counterparts. And so we have to start having these conversations so that we can keep our...
Tell me, what inspired you to do this work of, helping folks about HIV, STDs?
So, I always tell the story, and I'm very truthful. I worked for public health prior to coming into working with HIV, and a job came open and it paid more money than my previous job. And I was like, okay, I'm going to try this out. But once I got into the position, and there was a lady at a conference, and she was a older black woman who's talked about her story of how she contracted HIV. She had a husband who she didn't, I know, was using drugs, and he was injecting in between his toes. They were together. They ended up splitting up for some reason I can't remember. And he went away, got really sick, and called her, and he had HIV. And she had contracted HIV.
Wow. She didn't
And
know.
she did not know. And it just kind of brought things into the reality that a lot of times we think we're safe
Yes.
and we don't know that we're at risk. And then when I looked at the statistics of black women 8 times more likely than white women to get HIV, when I looked at the statistics for black men, especially our black gay men, 1 in 3 will contract HIV. I have kids, I have nieces, I have nephews, and I don't want another statistic when it comes to people who look like me. I mean, I'm for all people, but for me as a black woman, constantly having things that are negative affect my community is an issue. And so now my mission is to try to educate and to make some differences in our community, because this is something that's completely preventable.
Correct.
Stuff like this, like we have to start having more conversations. And we have to make sure that the misconceptions about HIV are out there as well. Because if you do have people in the community who are living with HIV and maybe they're like, I really don't want to go get treatment because I don't want to deal with the reality of what's going on, or I don't want anyone to find out. Understanding that agencies like myself can help link them and get them into care, knowing that HIV is not spread by casual contact. There are only 5 body fluids that can spread HIV, and so you don't have to be afraid of if your neighbor has it, or your child, or even your spouse if they're taking their medication. And so we have to make sure that people understand that, and then also understand that there are prevention methods. Like condoms are there, and it's okay to use a condom. You know, it's available. It's free. Someone who is HIV positive, they'll take medication that will make them undetectable.
Undetectable.
Okay. Someone who's HIV negative, they would take PrEP.
Oh, okay. So
But even if that person doesn't take PrEP and just that person who's HIV positive is taking their medication, it's 99% likely that they will not transmit the disease.
wow.
And so that person can have a baby and the baby be HIV negative.
Okay.
That person can have a partner and the partner not contract HIV because they're taking their medication. For me, I always say if your partner is positive, I would get on PrEP as well, just because I don't want anyone responsible for my health. And that's important, because a lot of people get upset when they get STIs or they get something from someone, not understanding that people are asymptomatic, meaning that they don't have signs or symptoms for some things. And so we have to take that responsibility that if I decide to have sex with someone, these consequences may occur. So how can I prevent them? With HIV, the signs and symptoms of HIV are usually flu-like symptoms. You may get like some swollen lymph nodes, different things like that, but mainly like a really bad flu, but it goes away. So we're in Kentucky.
Right.
Weather is up, down, all around. So if you got flu-like symptoms, you're not going to think anything of it.
Yes.
You're going to think you have COVID or you have the flu.
Yes.
So testing is important. Also, you can't look at someone and tell they have HIV. Someone with HIV looks just like someone without HIV. Years for HIV to kind of deplete your immune system. So I would probably do both.
Okay.
So if you find out your partner has HIV and maybe you had sex with them the night before, there's a medication called PEP that you can get, that you will be on for about a month, that will help to prevent you from getting. So if someone is sexually assaulted, or if, like I said, they find out their partner has HIV, then they can go talk to their doctor or to the emergency room to try to start that process.
Okay.
If you just feel like something may be going on, I always say get tested, so you have that baseline test.
Okay.
The tests that we do have about a 3-month window period. So usually when I'm testing couples, I say get tested, use condoms for 3 months, be retested again.
Okay,
And so
so
if that's
this
your only partner, then it has a 3-month window period.
the test for the HIV
Yes.
testing.
So anything that happened 3 months prior to that test is not going to show up. So today is
Wow.
August 21st. It's the 8th month. So anything that happened between May 21st and August 21st is not going to accurately show on that test.
Wow.
And so you have to, that's why it's important to have conversations with your partner.
Yes, talk.
Like, when was the last time you were sexually active
Be
with
honest,
somebody?
yeah, you have to be
You
honest
know,
too.
absolutely. What does this look like? And also talking about other things like, have you had any STIs?
Yeah.
You know, what else is going on with you? Because things are preventable. But like you said, prevention is better than the cure.
Yeah.
So if they can get cured and you can prevent yourself from getting it, then you're in a better place.
Oh wow. You see, okay.
Or if you have a partner and you know your partner may have a whole lot of other partners,
Yes.
and you're not sure if those partners have other partners as well,
Yeah.
because, you know, especially if that partner's not living in the same city,
Yes.
you know, then PrEP may be a good option for you, because that's going to
Yes.
prevent you
'Cause
from
you don't know.
have a doctor
Yes.
that you do not feel comfortable explaining your situation to. Get another doctor.
Move from that doctor.
Absolutely. This is your health.
Yes.
You
are
are
the CEO. I always say that.
absolutely, you're paying them, whether you have government assistance or whether you have a job,
Paid, yeah.
they're getting paid. And so you have the right to demand that you get the health care that you need, especially when it comes to, well, all aspects of your health.
Absolutely.
And so, but if you go to a hospital, sometimes hospitals have more better technology. And so those testing, it can be like a 2-week window period, depending on the generation of the test that they're doing. So if you need more quicker results, or if something happens and you go to the hospital and get tested, you will be able to kind of see a lot quicker if that person had anything prior to. But there's still that little bit of a window period anytime you get tested. So common STIs, syphilis is one that is still common. A lot of people don't realize how common syphilis is.
Okay.
Gonorrhea and chlamydia, and those are curable.
Okay.
And then we have herpes, and herpes is something that's treatable. And so you have to be really, mindful, because even sometimes if you don't have an outbreak, you can possibly pass it on. Or if someone has oral herpes, or basically like a cold sore, and if they provide any type of oral sex, it can turn into genital herpes. So making sure that your partner doesn't have any sores on their mouth if they're doing anything like that as well. We have, since I've been with UK, my team has, so it's been 4 years since I've been with UK, and I know that we have tested probably like 30 or 40 people positive for HIV, which is a lot.
Yes.
When you look at the small subset of people that we're engaging with.
Okay.
And it's not just people who are using drugs. It's not just people who are gay. We are testing straight people. And, so I stress that, because people get so caught up in gay people having HIV, and it is anyone who can have sex can get it.
Yes.
So we haven't done a lot. But that was one of the reasons why we started kind of meeting with you. So we are dedicated to working with the community and providing those services. We can do, we have translation services to kind of help have those conversations. So just knowing that the conversation may take a little bit longer, but we're going to get you the information and get you the services that you need. Which is one of the reasons why we started the on-demand testing. So if someone was to come here and tell you or your staff, I need a test, or I'd like to talk to someone from Target 4, they can call us. You all can call us. We'll come over, and as long as we have a private space to talk to them, we'll talk to them, test them if they need to be tested, get them safer sex supplies if that's what they need, or link them to whatever type of care that is there. And everything that we do, I always joke and say we are the Planet Fitness of HIV, because it's judgment free. It
Awesome.
does not matter what you do, who you do it with or where you do it at. We just want you to be safe, and we want you to have the things that you need. And so we are dedicated in learning the culture so that to make sure that we aren't offensive, and we'll ask you, hey, if something makes you feel some type of way, a conversation can be had, and we'll apologize and we'll try to make it work, because we want to work with your community, and we want to make sure that the services that are needed are had.
Yes. Yes.
Like I was saying, if someone comes in and says they want to talk to someone about HIV testing, or they don't even have to disclose if they're already positive. Maybe they want to just be linked to care. They can just come in and say, I would like on-demand services from Target 4. And I have someone who will be on call starting September 1st.
Okay.
And you can call our number. They will come out. They will talk to that person. If for some reason they're with someone else, we'll set up a time to either come a little bit later or set up a time to come the next day. The most important thing is meeting them in a space that's comfortable. So if this space is comfortable for them, then we want to come here to them. If someone prefers to come to our office on Dixie Highway, we can have space for them to come there as well.
Okay.
And so it's just about access and meeting people where they are. And like I said, our program is judgment free.
Yes.
It's about what do you need. So maybe you don't need to be tested right now. Maybe you just needed to have information because you don't understand about, maybe you need an understanding about PrEP. We can link you and get you a PrEP appointment with one of the many PrEP providers that are in the community. Or we can make sure that if you are HIV positive, that you get the resources that are available, that you're in with a case manager for Kentucky Care Coordination Program, that you're able to get to your doctor's appointments. So it's really all encompassing about keeping someone's health who is HIV positive or negative, but having that HIV health intact.